We have developed a three-step middle and long-term MCH development plan in 2008. By 2010, improving the MCH services system, setting up a premier insurance scheme, achieved the objective stated in the 11th five-year plan for health development. By 2015, to intensify the function of MCH services system to improve service ability and to achieve the hospitalization delivery for all pregnant women, to decrease the maternal and child mortality.
We're sitting here today because there are still at least 350,000, maybe more women who die every year when they should be giving life. And there are also at least 3.6 million babies who die in the first month of life. But what's different in this conversation here today, compared even to a few months ago, is we know that progress is actually being made. Those deaths are being reduced. We know that maternal deaths are coming down. We know that it can be done. We know that neonatal deaths are coming down. We know that it can be done. It can be done even in African countries, where I, as an African, am proud to say that within the last year even, one of the lowest income countries in Africa, Malawi, has come on track for reducing child deaths, partly because of what they've also done for neonatal deaths. It can be done.
We took poverty as our entry point. If poverty is addressed, all other things will fall in place. That's what we think. So we took this kick out, say, kick out poverty from Africa, so we Africans can start to address our own problem, and then invite you to work with us. It's a big challenge. Our African governments, even if they know what they're doing, yet the priority of women and children is not there. So we need to blow the trumpet, the vuvuzela. Stop them dying. The vuvuzela should stop them dying. Let us live. Let them live.
The global health agenda exhibits waves. Issues emerge and then they decline. But when they're emergent, people think they're going to stay there. But it's usually like this. So how do we make sure that 10 years from now we're not asking, where'd MNH go? Probably by institutionalizing at the national, subnational, grassroots level. Probably not by just talking at the global level. I agree with the points made that we must come to the corporations with sustainable business models. We have to understand their incentive structures and appeal to them. Moral exhortations won't work. They'll be short-term solutions. Second, like AIDS, in order to be sustainable, the maternal and newborn survival agenda must be politicized.
I asked all of you how comfortable you were. I asked you to think about what you were uncomfortable about. Because I think the metaphor in my mind, when I talked about the tipping point, was that of a wave. And are we, and all these other meetings, just the froth that goes at the top of a wave, and then as the wave falls down, it's dissipated? Or is this going to be a wave which involves the deep waters, the real people, that moves forward, and because it involves the deep waters, can make a real change? And I think to do that, we have to involve people, and we have to feel uncomfortable enough to do things differently. And I'm not yet sure that the influential people in this room are uncomfortable enough. So I invite you to get uncomfortable.